Preeclampsia. What is preeclampsia? Preeclampsia is a condition that happens in pregnancy, usually after 20 weeks of gestation, where a mother develops hypertension together with problems in organs like the kidneys, liver, brain, or the placenta. It can also happen after birth, postpartum. If it worsens and the mother starts to have seizures, the condition is called eclampsia. The only true cure for preeclampsia is delivery of the baby and placenta, but careful treatment can control it until delivery is safe. What causes preeclampsia? The exact cause is not fully understood, but the main problem starts with the placenta. The blood vessels in the placenta do not develop normally. This leads to narrow vessels, poor blood flow, and high pressure in the mother's circulation. The mother's blood vessels become irritated and leaky, leading to swelling and less blood reaching vital organs. What are the risk factors for preeclampsia? Prima gravida, first pregnancy. Previous preeclampsia in an earlier pregnancy. Family history of preeclampsia. Multiple pregnancies such as twins or triplets. Advanced maternal age, over 40 years. Adolescent pregnancy. Obesity. Medical problems like chronic hypertension, diabetes mellitus, renal disease, systemic lupus, erythematosus, SLE, or clotting disorders. In vitro fertilization, IVF. What are the clinical features of preeclampsia? For the mother, hypertension, 140 over 90 millimeters of mercury or more, severe if 160 over 110 millimeters of mercury or more. Edema, swelling of the face, hands, and sometimes legs. Headache that does not go away with simple treatment. Visual problems, blurred vision, flashing lights, or temporary loss of sight. Epigastric pain or pain in the right upper abdomen under the ribs, liver area. Nausea and vomiting in late pregnancy. Hyperreflexia, reflexes stronger than normal, sometimes with clonus. For the baby, intrauterine growth restriction, IUGR. Abnormal fetal heart rate or distress. Placental abruption in severe cases. Stillbirth if very severe. Complications of preeclampsia. For the mother, eclampsia, seizures. HELP syndrome, hemolysis, elevated liver enzymes, low platelets. Disseminated intravascular coagulation, DIC. Stroke, intracranial hemorrhage, liver rupture or severe liver damage. Acute kidney injury or kidney failure, maternal death if untreated. For the baby, preterm birth, intrauterine growth restriction, IUGR. Fetal distress, stillbirth in severe cases. How is preeclampsia assessed or diagnosed? Blood pressure monitoring, repeated checks, not just once. Urine tests, for protein, still useful though no longer essential for diagnosis. Blood tests. Platelet count may be low. Liver function tests, LFTs. Enzymes may rise. Renal function, creatinine and urea may rise. What monitoring is needed in preeclampsia? Urine output, measured closely to detect kidney involvement. Maternal symptoms, headache, vision changes, abdominal pain. Fetal monitoring, ultrasound for growth, fetal heart rate monitoring. Maternal counting of fetal movements, kick chart. Treatment for preeclampsia. General measures, rest, preferably lying on the left side to improve uteroplacental blood flow. Regular monitoring of blood pressure, urine, and baby's growth. Hospital admission if the condition is moderate or severe. Medications. Antihypertensives, such as labetalol, nifedipine, or hydralazine to lower blood pressure. Magnesium sulfate, given to prevent or treat seizures. The mother is checked for reflexes, breathing, and urine output to detect signs of magnesium toxicity. Calcium gluconate is kept ready as an antidote for magnesium sulfate toxicity. Delivery. Delivery is the only cure. If the pregnancy is at 37 weeks or more, delivery is usually planned. If earlier than 37 weeks but the disease is severe, delivery may still be required. The decision depends on the mother's condition and the baby's well-being. Postpartum care for preeclampsia. Preeclampsia can continue or even start after birth, postpartum, up to 6 weeks. Blood pressure should be monitored closely after delivery. Antihypertensives that are safe for breastfeeding are given if needed. Magnesium sulfate may continue for 24 to 48 hours after birth if the mother had severe preeclampsia or eclampsia. Mothers should be advised about warning symptoms such as headache, blurred vision, swelling, or breathing difficulty. For more health academic information, visit www.medocio.com. Healthcare ideas that connect,